everyone. Happy Tuesday. I hope you had a good weekend. For those of us here in the United States, it was a long weekend because of Memorial Day, which is why there was no show on Monday. So we have some catching up to do. Today, we are all about innovation from Rwanda to Sierra Leone. We're going to take a look at how innovation is shaping the continent's response to COVID-19. We're going to be talking about impressive-looking command centers, infection fighting robots, and the data-driven efforts of Africa's CDC. We're going to have all of that for you as we talk to a public health expert about what he's seeing in this tech-driven response to COVID on the continent. Also, when you look at case numbers that continue to surge from Russia to Brazil, it is clear that governments in the West continue to struggle with this pandemic. Meanwhile, in Africa, the numbers are still relatively lower. Is this a moment for Western governments to take a look at how African leaders are handling this crisis? Acclaimed journalist Gina Moore will be joining me, and she certainly thinks so. And as always, on today's show, we will end with the bright side. We have TV host, producer, and now entrepreneur Ty Beauchamp in the house. She'll be talking to us about how she is juggling her myriad business ventures and managing to stay somewhat sane during this quarantine. A lot to get through. Let's get to it. So one of the reasons for doing this show is not just to track the case numbers on the continent, but also to take an in-depth look at how, how governments are shaping their response to this pandemic, to look at the new ways of thinking, the way technology is playing a role, and how all of that is affecting the outcome. Technology, innovation is playing a role in a way we've never seen before in disease outbreaks this time around. I want to discuss all of this, the trajectory of the disease and how this response is shaping up with Peter Drobak now. He's a medical doctor and infectious diseases expert at the University of Oxford. He's also the host of a podcast called Reimagine, which is about people inventing the future. He joins me now from Oxford, England. Peter, welcome. Peter, you muted.
I was. I'm unmuted. Hi, Isha. Live television.
Happens all the time. Good to have you with us. Let me start by asking you for your response to what you make of comments made by WHO envoy, who said that basically Africa was heading towards a silent epidemic if leaders don't prioritize testing. What do you make of that? Are those fears that you share?
So clearly what we've seen in Africa so far across the continent is that it's been relatively spared thus far, right? The numbers of cases of the rest of the world, and we can talk about some of the reasons for that. A lot of it has to do with strong early action that prevented the disease from taking hold over the last couple of months as it has elsewhere in the world. But some of these things like lockdowns can't go on forever, and the virus is there. So there certainly is some risk that if we were to ease up and there were some complacency, that the virus could spread much more widely in Africa. There's no reason to think that it wouldn't. And so I can't say that I necessarily agree that it's inevitable, but certainly there is a risk. And testing is critically important because what we know, we saw that here in the UK actually when testing was deprioritized early on, that the infection can spread silently. And it's only weeks later when people start to get very sick and show up in hospital that you can actually see the true burden of that. And with an epidemic that can double the number of cases every couple of days when you're not doing enough to control it, that's incredibly dangerous. So this is a real challenge. And I think for the next phase of the response in Africa, that ramping up testing is going to be critical. There are real challenges right now because this is not an epidemic in one region. This is a pandemic that's affecting the entire world. And so right now all countries are sometimes competing for the same limited resources. And so sometimes in some countries in Africa, the funds are there, but it's difficult to actually purchase the reagents and the materials needed to do testing. And that's why the sort of global solidarity and cooperation is going to be so important.
You spent a lot of time in Rwanda, which is one of the countries that moved very, very quickly to shut down its borders and restrict movement. In March, I think it was March 14th, actually, they took their first actions. Talk to me about what stands out for you in terms of their response and how they're dealing with this crisis.
What really stands out actually is that it happened much earlier. So if we think back, it was December 31st when China sort of notified WHO and then the world about this new virus. A couple of weeks later, they sequenced the genome and published that. At the end of January, the World Health Organization declared this a public health emergency of international concern. By that time, Rwanda had already started a crisis management response, had begun training 500 health professionals to respond to this, had begun to set up an emergency operations center, which is phenomenal. And so they actually began planning for this all the way back in about mid-January, took this very seriously. So the first sort of more significant social distancing restrictions came on board in March, but they were already trying to build up laboratory capacity, looking at healthcare infrastructure, and starting to prepare for what was to come. And those countries that acted really early, not just Rwanda, Senegal was another example of that, have really done a remarkable job of keeping this in place. I mean, Rwanda has 0 reported coronavirus deaths to my knowledge, even today.
And Rwanda is one of, I think, about 6 countries that doesn't have any deaths to date. Rwanda, Seychelles, and I want to say Namibia, a host of countries. Can you see at a distance why that may be or what those countries have in common? Would it be the fast early action?
I think largely some countries like the Seychelles, of course, because it's a chain of remote islands, that early travel restrictions can go a long ways. Because they're more isolated, they can also be more protected. In general, I think that early action is certainly a part of the response. One of the other things that I think has been important that's not commented on enough in some of the African countries that have done a really nice job with this, Ghana, Senegal, Rwanda, Mauritius, is that they already had not necessarily the most advanced healthcare systems, but they had strong healthcare systems that were committed to equity and universal health coverage and this idea that everyone should have access to care. They had a strong social safety net. And that's so important because that's the first step towards global health security, recognizing that none of us are safe from this virus unless all of us are safe from this virus. And I think that's, critically important. And I hope a lesson that the world will take away from this as we move forward.
Those countries without any deaths recorded so far: Eritrea, Uganda, Rwanda, Seychelles, Namibia, Lesotho, and the region of Western Sahara. Technology has played a really big role in the response of many African countries. Talk to me about that. And I mean, you have obviously been on the continent and involved in past outbreaks of infectious diseases. Talk to me about the difference we're seeing now in this moment with COVID and how technology is reshaping the response.
Yeah, this I think is so important because what we saw in so many Western countries in the early days of this pandemic was really complacency and a bit of hubris or arrogance that it's not going to be a big deal and we can handle it. We didn't see that in very many places on the African continent. And that's largely because, these are countries that have been dealing with the risks of epidemic infectious diseases for a long time. And, most recently and most notably, of course, the recent Ebola outbreaks in West Africa and Central Africa. And so there was already infrastructure in place and actually investments that were made over the last couple of years to put that kind of public health infrastructure together to respond to new disease outbreaks. And that was able to be mobilized relatively quickly. The Africa Centers for Disease Control, the Africa CDC, was just created a couple of years ago. terrific scientific innovation, including in Senegal, the development of a $1 rapid COVID test, which is being trialed right now. Disease-fighting robots at the main COVID health facility, where the robots actually will do temperature screening, can identify people who may be coming without masks and tell them to wear masks, and can do a bunch of other things that can actually protect health workers who might otherwise be vulnerable to contracting the disease.
All right, I just want to double check something. I think I just heard that we've lost my picture. So we lost my picture, so we are having some tech problems, but let me double check if we got the audio. Oh, and I'm back. You see, I love this. This is the beauty of this new technology. It is sometimes flying by the seat of your pants, Peter. In terms of the communication strategy to populations, when I look at what's happening here in the United States, let's just stick with where I'm at, and I see the inability to significantly convey or the risk of this disease to the public, and we see them out in huge numbers versus what's happening in Africa. How do you measure up the communication? Where is it going wrong? How does Africa take from this example and do better in terms of making sure that people stay the course?
Yeah, we've seen across the world, I think that more than anything else, more than income, more than technology, more than the number of ICU beds, the thing that probably correlates best with which countries are doing well or really suffering in this pandemic has to do with leadership. And what we've seen in the US, in the UK, have been real significant challenges, not just in decision making, but in clear, consistent, evidence-based or science-based communication about the risks of this pandemic, the ability to bring people together and understand that I need to make choices not just for myself, but also that I have a responsibility to protect others through my choices to stay home, to wear masks, etc. And where this has been done with clear, consistent communication and strong leadership, like New Zealand, Germany, several countries we've mentioned in Africa, it's been really successful. In the US, of course, it's a shambles right now. The challenge is that we are, in some places it feels like, oh, maybe we're getting past this, we're past the first peak, some countries are starting to open back up. It feels like maybe we beat this. We're in the very early stages of this pandemic right now, right? If we were running a marathon, we may well be in just mile 2 or 3 out of the 26, and there's a long way to go. And we know that we can't sustain lockdowns forever because of the extraordinary economic damage that it causes, and particularly for families who are living on the margins, right, who are living day to day. This is a matter of really survival in life and death. And so the real challenge is going to be keeping people together and finding ways to get back to some semblance of normality while being able to make sure that the virus doesn't, sort of come back and sweep through the population.
Lisa, before I let you go, just one last thing that I want to ask you about. One of your colleagues there at Oxford was on the US network yesterday talking about this over-reliance on a vaccine, or the possibility of a vaccine being developed and deployed in a reasonable amount of time, and saying that really shouldn't be the focus. The focus should be on the tools that we have right now, and that we know how to beat this, and we know the measures that need to be taken to slow the spread of this disease. What do you want to say to people who are watching from around the world on this question of the vaccine and how much focus should be put on that versus the public safety, the infection control measures we have at our disposal? Yeah.
A vaccine may be the only way to beat this thing once and for all, but we don't know. We can't hang our hats on that. We don't know if a vaccine will ever work, and we don't know how well or how long it will work for. There's lots of reasons to be optimistic. There's an extraordinary sort of race across the world to develop vaccines and treatments, the likes of which we've really never seen before. And so that's hopeful. We've seen some good signs of that. we need to remember that this is not a foregone conclusion. HIV's been with us for decades now. We still don't have a vaccine for that, despite billions of dollars in research. And there's never been an effective vaccine against a coronavirus before. So we can hope for the best, and that would be that maybe there's an effective vaccine that we can start to see by early next year. But that's not a guarantee at all. So we hope for the best, but we need to plan for the worst, which is no vaccine for a long time, and look at all the other tools that we have to save lives and to protect our societies and our economy. And that's where we need to be investing now. Lockdown is not a solution. Lockdown is a way of buying time and saving lives while you make investments in the public health infrastructure you need, testing, tracing, isolation, that can break those chains of transmission. That's what everybody needs to be focused on right now.
Peter, thank you so much for re-emphasizing that. And thank you for your time and for rolling with the tech punches. Appreciate it.
That was fun.
Thank you. Come back again soon.
I'd love that.
Stay safe.
You too.
Thank you. All right, you heard it from Peter Droback there. Let's not focus on the vaccine. We want to be optimistic, but let's what we have at our disposal right now. I want to bring you up to speed with confirmed coronavirus cases across the continent. As always, we start with the big picture and the total caseload. Currently, there are 116,790 cases across the continent. Of those, the confirmed ones are there you see that 116,790. The active cases 66,278, if I could get my numbers out. And looking at the deaths, we've gone over that 3,000 number, 3,505. Let's drill down for a regional view, starting as always in Northern Africa, where Egypt is still out in front. Over 17,000 cases, rapidly approaching 18,000 cases. The big headline out of Egypt that is in all the newspapers is that the main doctors union is basically saying the government has failed to protect their doctors, and is directly responsible for the death of what they say is 19 doctors. The government disputes this, in fact says the number of doctors who have died is 11, but all of this is as a result of a young doctor who died a few days ago after being denied treatment. So Egypt under fire from their main doctors union for the number of medical deaths. Looking at Algeria, second most impacted country in the region. They have 8,697 cases, deaths 617. Let's turn our attention to Central Africa, where the most impacted country there is Cameroon. The number of confirmed cases has gone up. The country shot past that 5,000 mark, 5,044. Currently, if you look there, you'll see 171 deaths. We're also watching Gabon. With a population of just 2 million, they have eased restrictions there. Confirmed cases now 2,135. The cases are going up. Recorded deaths at 14. West Africa, my region. In Nigeria, they're entering the second phase of reopening. Total confirmed cases in Nigeria, 8,068. They've gone past 8,000. Total number of deaths, over 200, 233 to be precise. The surge in cases in the north continue to be of concern. Kano alone is approaching 1,000 cases. Let's look at Sierra Leone, my home country. 754 cases at last check, 44 deaths. In East Africa, Sudan, the most impacted country there, the numbers continue to climb. They are fast approaching 4,000 in Sudan. Number of deaths, 170. Djibouti is a place I continue to look at very closely, considering again how small it is, and yet the numbers are climbing. 2,468 there, and deaths 14. Let's finish up in Southern Africa, as we always do. South Africa, another day, another shocking number. As you see there, over 23,000 cases in South Africa. Number of deaths approaching 500, 481 to be precise. They are testing in large numbers. We have to say that they are, but the numbers continue to grow. Community spread is clearly an issue. Zambia's numbers also creeping up, approaching 1,920 confirmed cases in Zambia. Number of deaths, 7. That is a picture from the continent. Now, what makes the show different from the fact that we are battling technology challenges days is that this is an opportunity for you to be involved in a real-time conversation. This is what makes the show so exciting, that you can be involved. As the guests come on, you can write in, send your thoughts, share your opinions, your disagreements, what resonates with you, and we want you to do that. That's the whole reason we're doing this, so that you can be part of a real-time conversation. So please write in, share your thoughts in real time. But beyond today's show, we also want you to send your videos to tell us how this pandemic is affecting you wherever you are. Just your name, where you are, what you do for a living, and your experiences. For that, just email that to homewithishasesay@gmail.com. One of these days I'll get this email right. At homewithishasesay@gmail.com, or go to the Home with Isha Sesay Facebook page. So you have two choices. You can email, you can send it to our Facebook page. Either way, we want to hear from you, and we want to know what you are going through right now. And so after the show, start filming. During the show, start writing in. I want to hear from you. Okay, moving on. To the surprise of some, to date, till now, Africa has not been overwhelmed by coronavirus and descended into the mire of chaos and widespread panic. That has not happened, not yet. In fact, it's been quite the opposite. What we've seen on the continent is African leaders move quickly and aggressively to gain a handle on this pandemic. Contrast that to the stories out of Europe and America, where we've seen healthcare systems buckle, where we have heard from healthcare workers on the front lines pleading for resources to keep them safe, pleading for ventilators and beds. That was never expected. And it's led some to say, is this a moment for Western leaders to take a look at Africa and see how they have done it to date to keep the situation comparatively under control? Well, my next guest is acclaimed journalist Gina Moore, and she certainly thinks so. And she wrote a great piece on this very topic for the New Yorker magazine, and has some ideas as to why we're not having that conversation more broadly. Gina joins me now from Africa to talk a little bit more about this. Gina, welcome.
Hi, thanks.
Hi, thank you for joining us. It's good to see you.
Yeah, you too. Thanks for having me.
Thank you. Your piece was brilliant, and I think what struck me was just how, in this moment, despite the fact that this is a novel coronavirus, we're seeing people fall back on old tropes and old ways of thinking about the continent, and refusing, in the face of what they can see to date, to change their opinions. What do you make of this insistence in terms of holding a particular narrative about Africa and coronavirus? Because when I go online and I look at the headlines out there, even though we haven't seen it to date, this widespread mass carnage, the headlines still scream of, impending, doom, millions to die, Africa is on the brink. What do you make of all of that?
It's a good question. I wrote this piece in part because I was just befuddled, I suppose, by the fact that I was seeing all of these theories about why maybe it hadn't gotten quite as bad in Africa as everyone had expected yet. And I didn't see people taking very seriously the idea that maybe African leaders had to approach the problem differently. And let me only compare it to the United States, which I know because that's the country I'm from, maybe more responsibly. And I think that there's a sort of fallback expectation we have that is built up around the kind of details we point to when we write about Africa that seem like they tell us something, but maybe they don't, and they never quite get interrogated deeply enough. We know that Africa is comparatively poor. We know that Africa has quote unquote fragile health systems. But what does that really mean if you drill down? And even in a place where there's a fragile health system, there's a system, and what does it look like and how does it work? in some countries, those answers turned out to be actually very beneficial to the COVID response. So I guess I'm saying maybe it's a lack of specificity. I think it's familiarity. These are the questions we know to ask, and they get trotted out every time we have to ask questions.
You wrote this, you said, confronted with data patterns that don't match our own, the impulse among Western observers has been to identify what makes these countries like each other, but unlike us, to reach for the science or its best guesses that tells a soothing story about why Africa appears to have it so much better than, say, New York City. I think what's been interesting to me is how the othering of Africa continues. And you detail in your piece these various ideas or theories. And you say Western analysts cite climate, demography, and magic. Can you talk a little bit about that and how you came to that conclusion?
Yeah, I think part of it for me comes from having covered the Ebola epidemic in West Africa in 2014, having spent a lot of time in Liberia at the very beginning of what the world considered the outbreak, which was actually quite late for when the outbreak happened, but sort of no one showed up until August of 2014. And then coming back in the middle of it to this sudden thundered international response and really having an experiential feeling about the difference between those two moments and the ways in which experts who just arrived from somewhere in Europe or the United States were talking about the situation in Liberia and the work that had been, not really the work that had been done to date, because most of them didn't see it. Mm-hmm. And so that lingers for me in how I think about the world and the headlines that get written. And so when I saw the news articles start to creep up about, maybe because it's sunny or it's humid, I thought this really feels a lot like, they have Ebola because of traditional burial practices, which in Liberia look exactly like they do in New Jersey. And so this tendency to sort of point to Africa and say, well, what is it? Is something that I was familiar with. I was, though, nevertheless quite surprised to hear in March, I think it was March 23rd, Andrew Cuomo, the governor of New York City, when he announced that they were going to order a big supply of hydroxychloroquine. Before everybody was shouting about it, he was making provisions to get the drug and do some tests. And he said, well, they use it to treat malaria in Africa and they don't even have COVID there yet. So maybe these things are related. I don't know. Someone should look into that. And I thought, you're right. Someone should. Maybe before you do the press conference next time. But that level of thinking, right? Like, malaria drug, lack of COVID, ergo solution. But you would never think that if you were looking at New Jersey, right? So that transitive property of otherness that is at play often when we're writing about or thinking about Africa, I really wanted to interrogate. And also, I wrote the piece in part to interrogate my own assumptions.
Yes.
It was entirely possible I was wrong, that people weren't doing a good job or seeming competent. But when I looked at the numbers and I asked so many people, experts, why is it possible that these are low? Also because the early and quick response is working. And they said, well, yeah, that's possible. It's, we can't say it's the driver. We can't say it's causal, but the very fact that it's a possibility seemed important to insert into the conversation.
You also said this, which I think it's such an important point. You said much has also been made of how few things Africa has with which to fight the virus. Intensive care and ventilator capacity, for example, are low, and retaining healthcare workers has long been a challenge, in part because doctors and nurses can make more money by working in the West. These supply and personnel shortages are dire during a pandemic, but they don't exist in a vacuum. Can you just speak to that? Because I think it is so, so critical. And every time I read an article about Africa, it invariably says, okay, so to date, not many people have died, but they don't have enough beds and enough ventilators. So when it does come, they're all going to die. I'm being facetious, but that then does seem to be the tone. Can you talk about the context that's important here as to partly the reason why Africa is in this place?
Yeah, and I think the questions about beds and ventilators are, obviously important. If things get to the point where people need them, you want them to be there.
Mm-hmm.
But the idea that they're not there because of this sort of implied possibility that no one wanted to spend the money, or, and as I say this, what I'm doing is dragging into the conversation the other sets of assumptions that we make about Africa, right?
Mm-hmm.
Leaders are incompetent, governments are corrupt. And so when we look at the scarcity of something, we kind of fill in the gaps with that knowledge and think, even without saying it out loud, oh, well, that's why, right?
Mm-hmm.
But part of the reason that health systems are in this situation that they're in is because of structural adjustment policies from 30 years ago. I'm going a little wonky on you here, but the conditioning... The conditions that were put on international aid requiring African governments to turn their health systems from public goods into privatized fee-for-service sites of assistance, right? To look, that is to say, much more like they do, for example, in the United States. That hasn't worked out so well for us in terms of creating the provisions of supplies that we need for public goods in this particular crisis. But that has sort of laid a foundation for the scarcity or the paucity of resources that we see in African governments. And I don't think it's an accident that, when I was talking to Dr. John Nkengasong, who's the head of the Africa CDC, one of the things that he's really concerned about is Africa's inability to compete fairly in the market for ventilators, medical supplies, and PPE. And he's written a lot about this very powerfully and persuasively. The call that Africa is not asking for charity. There's money in the accounts to buy these things, but there's not money to keep getting outbid the same way that we saw in the States. California outbids Massachusetts, or, I'm inserting the names because I didn't follow that closely, but I know that was going on. So making market play fair play so that African countries can provide what they are organized to provide for their people in their response has been a real challenge. All of that has these deep historical institutional roots, and it bubbles up as we see it. And then, of course, there's the brain drain of trained personnel who work in especially British and American health facilities, nursing home facilities, where they make very little money compared to what people in the United States or the UK could make doing other professions or even in the medical services. But they make much more money than they'd be able to make at home. And so when you look around and say, oh, there's only 7 doctors for every 10,000 people in Sierra Leone, well, this is part of the reason why. And that's not going to change until we start fixing these inequity problems.
Indeed. Gina Moore, it is such a great piece. I urge everyone to read it and to challenge their ways of thinking. And again, just a deeper understanding of the inequities and to see it in its proper context. Gina Moore, it was such a pleasure. Thank you.
Thank you too. Thanks a lot.
Stay safe. Really interesting piece. Please go back, dig it out. It's in the New Yorker, and I think that you will come away with a lot from it. I want to get to your comments because you have been writing in, and I want to say thank you. Thank you. So many of you enjoyed that conversation with Gina Moore and saying so. Suzanne C says that. She says, here to see Gina Moore, and also lots of people saying good evening. Matilda Jalla, Adam Maxwell. Also good to see, I'm looking at comments because I'm scrolling through in real time. I'm going through. Paula Mora says, you're amazing, to Gina. Faith Casina says, so good, Gina. Lots of people really enjoyed it. Zaina Bar agrees with Gina's statement. Shante K, Amnata Radia Say, lots of positive feedback on that. So again, go to the New Yorker, pull it up. It's a piece by Gina Moore taking a deep dive into Africa's response and the way it's being perceived in the West and the assumptions being overlaid on the situation there. So thank you so much for all your comments. Again, I go through them in real time, so sometimes if I go quiet, I'm trying to find them. But lots of people watching from Delaware to Europe, Lisbon, Namibia. Lots of people in-house, Germany. Thank you for being with us. All right. Let's move on now, and let's talk about the situation in my country, Sierra Leone, where there are 735 confirmed coronavirus cases and 42 deaths. That's at last check of Johns Hopkins University site. They are, of course, collating the data. My country, Sierra Leone, is no stranger to fighting infectious diseases. As we all know, back in 2014, it was on the front lines alongside Liberia and Guinea in battling Ebola, an outbreak which claimed about 11,000 lives in that region. Fast forward to today, and Sierra Leone is once more and fighting COVID right now. But what they're doing is they're looking to the past for those lessons that they learned then, and they're fusing them with new ways of thinking. They're looking at technology and innovative ideas to minimize the fallout from this pandemic. Joining me now to talk about how the country is shaping its response to COVID-19 is Sierra Leone's Minister of Education, David Moinena-Senge. He is in charge of the education portfolio, but he's also the country's first ever Chief Innovation Officer. He is also, at times, his family's point man for childcare. You may have seen those pictures that he posted of his little one tied to his back, which made headlines everywhere. He is a busy man. He has a lot on his plate, but he made time to join us. And I'm so pleased to welcome Minister Senge to the show. Mr. Minister, welcome.
Thank you very much. Thanks for having me, Aisha.
It is very good to have you here. Very, very good indeed. I know how busy you are. So, I do want to again say we are very grateful. Talk to me about Sierra Leone's response to this pandemic and how it really is very much trying to look from the past and fuse it with new ideas and technology for today's battle.
So I think there are a couple of different parts. It's that we do have an experience and we do have a leadership that made decisions very early in our response. And so even before we had our first case, we had invested significantly in preventive measures. We had quarantine facilities and regulations at the airport. We had everybody who came in on flights originally used to be just from the epicenter countries, 3 countries, and we expanded that quickly. And we had people going to quarantines at hotels. And then we had our case. We had the transmission internally, and then we closed our land borders as well. And we closed schools. So we closed schools just the day before we had our first case. We'd given a 2-week notice to all schools, but we decided that the day we have our index case, we'll close schools anyway. So we've invested a lot of time and resources and people and systems to prevent the disease coming. That was phase 1. And that has paid and that has worked very well because we'll follow through with many of those controls in place, and we're able to go in for case management and isolate and track and link. And very early, we also, as you said, focused on technology. So we've been doing genetic testing from a very early to try to see the links between our cases. And we've also have been able to use data. I'm going to call Nina. Sorry. We've also have been able to use data and be able to, for our contact tracing. So for our surveillance and our contact tracing, we've been able to do that, and we'll build systems. So we have the Directorate of Science, Technology and Innovation, which I also help lead. And we worked with the EOC, the Emergency Operations Center, to build systems for self-assessment. So people talk about there are all these apps to do self-assessment, but these apps are working on data. In Sierra Leone, connectivity is about 19%, but yet our 2G, 3G feature phone, cell phone connectivity is at 80%. And so we build systems that allow for people to use SMS and USSD technologies that they already understand. So within a 3 weeks to 4 weeks period, we have about 2 million interactions, 170,000 users, which is much bigger than countries who have some of these apps that people are using. So we invested very heavily in preventative measures. And when we had our first set of cases, something that we've done very well and that we did very well then was to focus on contact tracing.
Mm-hmm.
So when we had our first lockdown, we ensured that all our primary and secondary contacts, well, definitely all our primary contacts in our first lockdown were identified. And then a significant amount of our secondary contacts also were able to identify. Again, same tool with our second lockdown. And for testing, we made sure that these rapid diagnostic tests we had early, and we stopped using them because we went through rigorous scientific methods. We use the PCR test, so we use genetic testing, DNA for all the proteins, both proteins for COVID. In the beginning, we tested across 5 labs, and we dropped that down to 3 labs. We dropped it down to 2 labs, and each lab has 2 samples. So very rigorous scientific methods.
So with all of that, though, it is notable that even though Sierra Leone is doing all of this, it is notable that of the 3 countries, again, that were involved in the West African Ebola outbreak, Sierra Leone, Guinea, and Liberia, that though we don't have as many cases as Guinea, and we're looking at the situation in Liberia, and it escapes me how many cases they have, but we do have the higher mortality rate of the 3.
And it is noticeable. And this is one of those instances where transparency and overgiving information is used by people to say, it means you're not doing well. Okay, and I followed the conversation that you had earlier about health systems. Our health systems and the health systems in these parts and the general dailies, the life adjusted, the quality of life that people have remains true. The health system challenges remain true. Mm-hmm. And yet, in those instances, so let's say for how we measure death, and every country, by the way, has different measures of death. No country has the same death that they're reporting on COVID to be the same. And in Sierra Leone, the method that we used was any death that is of somebody who tests positive is reported as a COVID death. Mm-hmm. There are countries, many countries, who only report deaths for which somebody tested positive in a treatment center. Mm-hmm. And there's nothing wrong with that. It's just their approach. It's just their decision. And what we have done in Sierra Leone, because of our robust methods and focus on data, we said that we wanted to measure any death that was tested positive, whether you died in the facility or whether you died at home, if we had an indication that it was a positive test. And there's also another element to this where people who come to our health facilities, they come, say, 24 hours. And within 24 hours of arrival in the health facility, they die because they're showing up late. It's not an indication of, that they're not getting treatment at the treatment facility, that it's substandard. And if we do break down those numbers, and we do have that, and this is something that we're trying to do, if you broke down the numbers of how many deaths happen 24 hours when you arrive at the health facility, 48 hours, over 48 hours outside the health facility, which are all measures that are valid, you actually see that for us to be able to compare to other countries, we're doing very well in terms of our treatment.
And so I'm glad that you were able to break it down and show the differences in the ways data is being assessed or measured or collated, and that was important for you to say that piece. One thing that I do want to ask you to speak to, though, because obviously I am from the country, as you know, and I do have a lot of family there, as you know, is just in terms of we're using all this technology and it's great and it's making a huge difference in terms of data collection and being able to break it down and analyze it. In terms of the communication to people on the ground, in terms of the risk, in terms of getting people to do what is necessary, talk to me about that challenge and how one scales that up or intensifies that effort, because this fight is just beginning.
I think you're absolutely right, and I was just in a task force meeting just now, and the president spoke about, and I wrote it down, collective discipline. And one of my colleagues, the ACC commissioner, says peopleship, and this is really that. For countries to be able to fight this disease, there has to be this peopleship, this collective discipline, and a commitment to say, if there's a breaking chain, if any one person does not wear masks, or if any one person does not do social or physical distancing, if any one person has symptoms and they don't call 117, if any one person hides a primary contact from somebody, if any one person breaks quarantine rule, you put everybody at risk. That's one set of communication. There's also the communication about how asymptomatic cases, and people can say, "Look, I'm fine, I'm healthy. What do you mean by I need? I'm not sick. I don't see what's happening in Italy happening in Sierra Leone. I don't see what's happening in Spain happening in Sierra Leone. So there's no problem." And even though from 2 months ago, when we did, because we did all these surveys and assessments, about 98 to 99% of people knew about corona more than a month and a half ago and knew the cough were symptoms. And so it's a question of, you know what corona is, you know what the symptoms of corona is, but that disconnects to say, I have a symptom, I'm going to call 117 so I get tested, and I just got tested, and I'm going to go to the treatment center, I'm going to list all my contacts, just requires people to buy in and then this element of trust. And it's very difficult. It's very difficult because people are remembering the horrors of where we were during Ebola, and they don't want to imagine that that's possible. And because and we're also fighting misinformation. We're fighting fake news. There are people who are actively trying to undermine what government is doing. So a combination of people's ability to understand and parse this data, fake news and misinformation, and people also just being scared. And yes, I mean, I do think we do have challenges in communication. That's why the president appointed a spokesperson to go to the EOC. We do have a risk pillar and a communications pillar, and they will be the first to tell you that we do need to do more. And that's not a blame on anybody. It's just that we all need to do more in our communities, in our homes, in our workplaces, such that when somebody jokes, this physical distance thing, we have to relax. You say, no. It's not a joke. We can't laugh about it. It's your responsibility with your friends. It doesn't matter whether they're learned or not to enforce those. And that is the challenge, is that we are having a difficult time to getting the seriousness of this. Because the thing is, if we don't protect ourselves and ultimately our loved ones, it is our mothers and fathers and grandmothers who are going to easily succumb to this. And it is that we are finding it difficult as a people to understand that this disease is not about us. It's about the other person. It's about what you're doing to protect the other person.
Well, Mr. Mensah, sadly, we're out of time, and we didn't even get to talk about education. I hope we can get you on again so we can talk about education. You have too many portfolios, or rather you have many portfolios as opposed to too many. So I hope you'll come back and so we can talk about education, which, as you know, is important to me, and specifically keeping girls in school. So I'm making that plea to you for you to come back so we can pick this up.
It sounds good. I'll come back to talk about that specifically.
Thank you, Mr. Minister. David Moynihan-Sengeh, thank you so much. Please be safe.
Thank you. Bye.
Bye. Okay, so a lot of people watching that conversation, a lot of my people from Sierra Leone weighing in and with strong opinions. We're going to try and get some of those in a little bit later on. There's always a huge amount going on in our thread. So we're going to just keep going because I want to talk about another sector that's being impacted by coronavirus. We're over 2 months into this quarantine, and for many people who are, under lockdown, they're turning to the arts for some kind of a respite. They're looking at movies and books and taking advantage of access to all the art that is online. It's just something to kind of lower the tension and just take their minds away from where we are right now. But artists, art galleries on the continent are all feeling the pain of COVID-19, and we want to talk about what they are facing and what the future may look like. Here to discuss this is Touria El-Glau. She launched the 154 Contemporary African Art Fair, a world-leading platform dedicated to contemporary art from Africa and the diaspora. She joins us now from Grimaud, France. Welcome. Touria, can you hear me? She looks like she's frozen.
Yes,
I'm back.
Hello, it's technology. Thank you. So good to have you with us today. Talk to me about what you are seeing in terms of the impact of this pandemic on African artists and the business in general in Africa.
Well, we had our first experience ourselves by not being able to produce the show we're supposed to produce, specializing in contemporary art from the continent. So, I mean, what we're seeing is galleries who are banned to travel, who cannot attend shows, internationally and represent their artists. But we're also seeing the artists not being able to sell at the moment because all those platforms, physical platforms, have for the moment ceased to exist, at least temporarily, because banning, more than 50 people in most of the countries where we're doing this event, is part of the new regulations. But I mean, like most of the art world, we are, trying to get a solution through the digital platforms and having to develop in less than 2 months, some kind of partnership, to be able to provide and support artists from the continent. So we are seeing a solution that is a temporary solution, but is also a way of accelerating, let's say, moving to the digital space with the contemporary artists from the continent. The good news is that for a lot of artists from this side of the world, a lot of them have been discovered through their social platforms, using Instagram or Facebook. And I think that we see much more of that. We also had galleries from the continent, over probably 70% of their sale are internationally, through PDF or through sending work to collectors outside the African continent. But there's definitely going to be a suffering because all those galleries representing artists or even artists themselves are considered, entrepreneurs or small businesses in Africa.
Yeah. And that's what I wanted to pick up on, because I want our viewers to understand that what we're talking about, there's not, in terms of seeing art through the lens of it being a luxury, but seeing it as a vehicle towards changing the narrative about the continent, showing its creativity, and also the galleries and those who are involved in the process of making art as employers. Right? And lots of people are involved, lots of jobs are involved, and all of this is impacted by COVID.
Of course, unfortunately, on the continent, not all the small businesses have the support of their government. So I'm based, for example, in London with my company. So the UK government is supporting the arts, so they give loans and support grants, for developing different art platforms. But when you come to the infrastructure on the continent, it's completely different. We don't have enough institutions. We definitely don't have enough support from the government, when it comes to the art industry. So all those small businesses who have a very strong focus on, creativity, for example, are completely on their own, when it comes to supporting their artists, but also supporting, the way they can sell their business. And to be honest, as much as it's very entertaining during this time of COVID, because you're stuck at home, and unless, you're very lucky, you're in home with full of art, being able to go back to the internet to check out some, virtual exhibitions or virtual shows on galleries' website, it is quite difficult for a regular person to discover art at the moment because they close at the house, and this is definitely something that when I talk to all the suppliers or the participants of the fair, they are very limited in what they can do. So even in the platform online, from what we understand, is that it's also about shipping the artwork. So even if they are able to sell and get this visibility, it's for the moment not possible to sell the work, so, or ship the work. So it's all those economies around the art industry that is affected as well.
Yeah, it's such a painful time for so many. Toure Elgo, thank you so much for joining us to give us some insight into what your industry is facing. And as we say to everyone, we just hope it gets better and gets better quickly. Thank you so much. Stay safe.
Thank you. You too. Take care.
Take care. COVID impacts the world, Africa specifically, in so many different ways. And every day on the show, to
bring you those different perspectives. So you see it not just in terms of health and economy, but also in terms of art, creativity, education. We cover it all here on the show. Again, let me get to all these comments that are here. Again, lots of people from all over the place saying that they're enjoying. Barbara Goldenberg is watching from Delaware. Lots of people saying how much they enjoyed the conversation again with Gina. Margaret Moiba says, I'm very proud of the African continent. Africa should be recognized for their good job and preventive actions. Many ignore the success being achieved and just keep on repeating how bad this pandemic will hit Africa. It is disturbing. Yeah, indeed. Karu Kamara just very quickly saying Africa cannot practice social distancing, but I do believe masking up should be mandatory. And lots of people who were pleased to see the minister from Sierra Leone on the show. So there you have it. Very quickly, before we go, we're keeping an eye on 5 stories for you in the hours ahead. Let's run through them for you. Schools are reopening in Ivory Coast after being shuttered for about 2 months due to coronavirus. Kids are back in their classrooms. They made it back to school on Monday now with masks on. Ivory Coast currently has 2,423 confirmed cases and 30 deaths recording. It's one of the first countries in the region to open up schools, so neighboring countries clearly watching it closely to see if the opening of schools comes with a spike in cases. Mauritius, let's talk about Mauritius. You'll remember that a couple of weeks ago, I told you that the country had declared itself virus-free. In fact, the health minister was quoted as saying they'd won the battle against coronavirus thanks to the cooperation of the public. It must also be added that he said the war against the virus was ongoing. Well, sad to say that after 28 days without any new cases, Mauritius did record 2 new cases on Sunday. The Prime Minister will be addressing the nation this week. Turning to story number 3, we're watching for you Mozambique. A 13-year-old boy in that country has become the nation's first coronavirus fatality. And the National Director of Public Health confirmed that and said that the death occurred in a northern province. This comes as Mozambique currently has 209 confirmed cases. They have also launched a free coronavirus hotline number because they're trying to reduce the number of people who actually make their way to healthcare centers, so they can call the number to report their symptoms and get some medical advice, but they can also use that number to report people who are flouting coronavirus restrictions. Story number 4, Uganda. Uganda has begun to ease its coronavirus lockdown restrictions. That begins today, Tuesday. The government says it will distribute free masks to anyone 6 and older. According to a senior presidential aide, the lockdown will be eased slowly. So that means in some parts of the country, you start to see restaurants and bars opened and some private cars on the road, but borders will remain closed. This will be taken slowly. 5th and final story we're watching for you in the hours ahead, Madagascar. If you watch the show, you know we talk about Madagascar a lot. Despite claims of having found a cure for COVID, the country is now grappling with a surge in cases in its 2nd largest city, Talmasina. Since Thursday, 122 new cases have been officially confirmed there in Madagascar's 2nd largest city. A special council of ministers meeting was held in the capital on Sunday, according to a regional official. Doctors have been deployed to investigate the cause of deaths, and 150 soldiers have been sent to reinforce efforts to keep the peace, or certainly to keep public order and ensure that infection measures are followed. So that is where we are at in the 5 stories we're following for you. Okay. As always, we end the show on the bright side. Something to put a little smile on your face, something to just take you out of this moment that we're in and just help you remember that we will make it through this. Joining me today on the bright side is Ty Beauchamp. This woman is a phenomenal force. She is a host. She's been dominating the publishing industry for many, many years. She was a beauty and fashion editor at Harper's Bazaar, Good Housekeeping, the Oprah magazine, Vibe, Vixen, 17. She's also the co-founder of a brand new venture, Brown Girl Jane. That's a plant-based line that promotes alternative medicine for women of color. We caught up with her earlier today. Take a look at what she had to say.
Good morning. Good morning. I am Ty Beauchamp, co-founder of Brown Girl Jane, a luxury CBD and plant-based wellness company focused on centering women of color. I am also the founder of Thai Life Media. I'm a producer, a television host, and a creator. Wow, what has COVID been? What has this season been for me? I will tell you this, it has been a season of great reflection, a season of great pause, and also a season of unexpected blessings, to be quite honest. And I feel really grateful to say that because I know that so many people are struggling during this time, whether it be, loved ones being sick and losing them, and or just being in a space of uncertainty. But what I vowed during Corona, as the onset of Corona started, is that I would not come out of this process the same. So in addition to working on Brown Girl Jane, we're launching a new product to the collection on June 1. So I've been working diligently on that. I have also just spending a lot of time going inward. I've been fasting. I've been praying. I've been working out. Let's see if I can show you. I've been working out, hiking a lot. I started the 1,000 skips a day challenge with Ty, and I can proudly say that we've had hundreds of people join us on this challenge. So it's been a time for me to go into serious reflection, a time of being very intentional about who I am and who I'm becoming. I really do believe that we are in a space right now of transformation. It's a season of transformation for everyone, no matter where you are in your life's journey. So I've been really grateful to be in this space. I'm excited to speak to my girl, Isha Sesay, today, and I'm sending you all amazing love. Talk soon.
She is such an amazing soul. She is a friend. I can't wait to have this conversation with her. We will go deep. We're having that conversation over on Instagram. So do join us over there on I am Isha Sesay is my handle. We're going to end things here, whether you've been watching on Facebook, Twitter, or on YouTube. Thank you for being with us today for Home with Isha Sesay. Tomorrow is Deep Dive Wednesday. I want to tell you, we have a very, very special show for you tomorrow. We are going to be talking to a trio, 3 doctors who have been in the trenches in New York City in one of the hardest hit hospitals. They all have African roots, at least 2 of them, and will be telling us about what it is like to actually treat COVID at its worst. So we talked a lot about the science in the last few weeks about, the virus and the cells and what it's doing, but to see it, to deal with hospitals that are collapsing around you, we're going to take you inside that effort and bring you the real details from these people who were treating patients at the height of the pandemic as it hit New York City and their takeaways for Africa. All of that will be discussed on Deep Dive Wednesday, which is tomorrow's show. I promise you, you won't want to miss this. It is a special show. 3 doctors who were in the trenches fighting the pandemic in New York City. We'll have it all for you tomorrow. That does it for us. Be safe, everyone. See you back here, same time, same place tomorrow. Bye for now.